Good morning, Treasure Coast. It's a nice Monday morning. That, of course, means it's time for Senior Talk, brought to you each week by Harbor Place, a senior living community located at 3700 Southeast Jennings Road in Port St. Lucie. And this morning, we are joined by Diane McDonough, the Director of Sales for that operation. And good morning, Diane. Please introduce your guest this morning.
Good morning, Paul, and to all our listeners on the Treasure Coast. Are you homebound and in need of medical care? Do you want more access to your provider? We may have an option or solution for you. Our special guest today is Jackie Conkling, Marketing and Scheduling Coordinator of Housecalls Express. Good morning, Jackie.
Good morning. How is everybody doing today?
We're doing great here.
Just fine. Thank you for coming.
Thank
Please-
you for having me.
Please tell us more about you and your position with Housecalls Express.
My name's Jackie, and I work with Housecalls Express for the last 2 years. We are a mobile primary care practice that serves the Treasure Coast for 17 years, seeing patients at home.
Okay.
Why don't you go ahead and start that over again? We had a little microphone difficulty there. Go ahead, Jackie. Start over again, please. Thank you.
Sure. My name's Jackie. I work with Housecalls Express. We are a mobile primary care practice that's been serving the Treasure Coast for 17 years, from Vero to the northern Palm Beaches. We see all of our patients in their home, whether it's residential or at a assisted living facility.
All right. How and who created this business?
Back in 2001, our managing partner, Jeff Holy, was a PA in the ER and noticed patients coming in with issues that could have been resolved sooner, but since they weren't resolved, that they would come into the ER. So he felt that maybe if he had a service that would see them at home and facilitate some of these things before they got out of hand, they'd be in much better shape. So he created Housecalls Express.
What is your contact information if someone wanted to reach out to you in your location?
The best way to contact us is by calling us at 772-781-2207. You could also reach us on our website, and that's www.housecallsexpress.com. And a lot of our contact information is there as well.
Being in business 17 years, it must be successful. How many visits per month does your staff take care of?
Approximately, we see about 300 to 400 visits a month throughout our community.
What types of patients qualify for Housecalls Express in-home medical services?
Any person, young or old, sick or injured, or otherwise unwell qualifies for our service. However, if they have Medicare, they need to have a taxing reason why they cannot leave the home. And homebound does not mean the patient has to be bedbound to qualify. The patient is considered homebound under Medicare if patient cannot leave home without a considerable and taxing effort. And that could mean required an aid for support, requires a use of special transportation, needs assistance with another person with them, or has a condition that leaving the home is medically conducive. Thank you.
And then the symptoms of the disease process, of course.
Right. So shortness of breath, confusion, Parkinson's, patients with Alzheimer's would also qualify.
Okay. The patients cannot be disqualified from the services if they leave their home for a non-medical absence. Am I correct?
Correct.
Okay. What conditions can you treat as a company?
We can treat patients for primary care needs, just like you go to your regular primary doctor's office. So we would come to your home, give you a regular checkup, review your systems, listen to your heart, lungs, blood pressure, check your ears, focus on acute problems that you might be having that day, refill any prescriptions that you need, and also arrange for a variety of other things, lab work, radiology. We could send referrals for specialists.
All right. I know that a lot of seniors and most people have their choice of pharmacy, whether it's mailed in or through the VA or a certain pharmacy. Who do you use?
We always ask our patients who they use, and we could work with any pharmacy that they are already working with, or recommend one that might be able to deliver to them. A lot of people these days are moving towards the delivery pharmacy system, but we do work with a wide variety of pharmacies in our community and have the ability to prescribe and refill medications with our electronic medical record system, so we send them via the web.
Ah, fantastic. That makes it more convenient. I just noticed also that you give medical care for minor emergencies.
Correct. So if they have a flu, a cough, cold, nausea, a sprain, if a patient had a fall or any foreign bodies in the eye, we could come over and see you and facilitate that.
Can Housecalls Express become my primary physician?
Yes, we are capable of being your primary physician, and for most of our patients, we are the primary care physician.
When a patient or a customer or patient, however you want to say, calls in, is he or she seen by a nurse, a doctor, or it's a combination of each, or how does that work?
All of our patients are seen by either a physician assistant or a nurse practitioner. We have them go right out to the home or their assisted living facility or independent living community, but they all are under our medical director, Dr. John Gozar. And all of our providers have access to Dr. John Gozar day and night, and he does review charts and speak with them and is constant contact.
Is Household Express a national company, or is it just local here?
It is a local company, privately owned, started by a local gentleman. So we are not a big company relatively.
And you service the area code 772. Are you from Vero Beach down through Stewart, beyond that? Or?
Vero Beach down to the northern Palm Beaches.
Okay.
All right. If someone had called you and asked for your services, take us through the steps. What should they expect, and what do they need to provide?
If you're looking to schedule a house call, what we do is you give a call. There's an appointment line, and you would speak to a staff member. Mostly it's me. And then we do a new patient form over the phone. And the things we would ask is obviously your name, date of birth, your address we'd be seeing you, any special instructions for your address. We would need your insurance information. So if you have a primary insurance, a secondary insurance, I would need those ID policy numbers. And then we would also need any type of a medical history, a brief summary, your previous or current primary care doctor, and emergency contact information. Once we get that, then we verify insurance. So I would check with Medicare, Blue Cross Blue Shield, United, whatever insurance that you list, and verify your benefits, because we want to let you know about your benefits before we schedule your appointment so you know at what cost this is for you. If you have Medicare, Medicare will cover 80% of our visit after the Medicare deductible has been met. So that leaves 20% left over. Certain supplemental insurances may cover your 20%. So we always like to verify that for you. Once we verify the insurance, we give you a call back, explain what benefits you have to you, and what, if anything, is left over.
All right. It's within 24 hours? physician assistant will come out?
Most times it's within 24 to 48 hours that we get you on the schedule.
All right.
Do you find that most people who call, let's face it, most of us have our own doctors, and we go to the clinics when we're sick. The person who calls you, are they typically without a doctor, or is that they just don't feel like they can make it to the clinic?
Most people who call us are actually family members who can no longer get their loved one to the doctor. It's actually become difficult getting them in the car, the whole process, sitting in the waiting room. Those things just become a long day, and it's tiring. So a lot of our phone calls are family members. Sometimes it is a person who just no longer can drive, and public transportation isn't quite available. Some people want to use us as needed, which is perfectly fine. Their primary care doctor can't get them in for a month, 2 months, and they need something done right away. So we have some patients that have a regular PCP, but use us when they can't get in for those urgent needs. Maybe they're feeling like they have a UTI or a flu or something short term going on, and their primary can't get them in, and they don't want to go to a walk-in. So once you're established with us, you could use us like that as well.
How quickly can you respond to a phone call?
We answer the phone 24 hours a day, 7 days a week with a staff member. There's also always an on-call provider on. Monday through Friday, our office is open from 8 to 5 p.m., and we have several people working in the office. And we try to answer every call that comes in. If you ever do call us and reach our voicemail, just leave a message. It's most likely because we're already on the line with another patient, but we always call back.
So after 5 o'clock?
After 5 o'clock is our after hours, and that's when a staff member is on. And if you called the office, you could hit number 2, and that's how you could get a staff member that's on for after hours. Explain what situations are going on, what symptoms you might be having, and there's also an after hours provider on. And so our staff member would speak with the provider, and depending on what's going on, make a recommendation for that patient.
All right. As I heard you, that Housecalls Express can become the primary care physician. I know that these questions might happen. One of the questions is, do I have to give up my doctor if I have been seeing that I've been seeing for years? Do I have to give him up because I'm using you now?
Not at all. If you want to stay with your previous and current primary care doctor, that's absolutely fine. We work with local primary care doctors a lot. We would just need to know who they are and their contact information. We would also like to establish that if you're going to continue seeing them, we would only be what they call as needed. You can't have 2 doctors under primary care treating you at the same time for the same reasons, mostly because Medicare and other insurances won't cover that. But like I said before, if you couldn't get into that particular doctor and used us in between, you could do that, and that would be okay.
All right. You did describe some of your services, but tell us more about the other types of medical services that you offer.
So we offer history and physicals, sick calls, employee physicals, annual communicable disease screenings, PPDs, immunizations, such as flu and hepatitis. If you are moving into an assisted living facility, we can complete an 1823 and skilled nursing form. And if you have a sports team, we can provide physicals for sports teams.
I find the service very unique. I know that being in the business I am in, I have heard of concierge doctors. What's the difference between a concierge doctor and Housecalls Express?
Housecalls Express is not concierge. It's my understanding that if you are with a concierge practice, you pay an annual fee, and then you have 24/7 access to the doctor. Housecalls Express, there is no annual fee. There's no sign up. There's no agreements or contracts. We are just like any other practice. If you come to us, there wouldn't be any extra added cost for any patients than what the insurance wouldn't allow. And also, if you wanted to stop not using us, which we hope you don't, but there wouldn't be any penalty or anything like that. You're welcome to come and go, but we just are here to serve all of our patients.
And there's not an agreement to sign then?
No agreement to sign. When you sign up with us, there are, of course, regular consent forms and HIPAA forms, but those are the only forms that you would be signing. And that just, reviews HIPAA and privacy. And then the consent forms to treat, saying, yes, you can come see me. And then there is a medical records release form that we have patients sign. That way, if they do go in and out of any hospital, we have a signature on file stating we could get your medical records from the hospital so we could better see what happened while you were there.
All right, let's talk more about payment and insurance. If I don't have supplement insurance, or if you have Medicare, what's a form of payment, or what do you expect?
Okay, so let's say you have Medicare only and you just have met your deductible, which for 2017, the Medicare deductible is $183. Once you meet that deductible, Medicare will pay 80% of our visit. That will leave 20% left over. That's going to look like anywhere between $25 and $45. So that would be the 20%. So that would be your responsibility. And what happens is we send the claim for the visit through Medicare, and then once we get the claim back, we would bill you. So it would be a statement sent to you. We send statements monthly, and you could write a check. You could call us with a credit card, or some of our patients like to give our providers cash at the time of visit. So that would be up to you. For some of our patients, they keep a credit card on file, and we give them a call before we charge it to let them know your statement has come back. This month you owe X amount of dollars, and then they would approve the payment.
All right. And who do you treat? Is there a certain category of?
Main patients we treat are seniors, homebound seniors, seniors that don't drive anymore, who perhaps might have some diagnosis that don't allow them to get out or become taxing to get out into the community. We also see a variety of patients at assisted living facilities in the area, such as Harbor Place. Our provider, Donna Benya, who's a physician assistant, has been going to Harbor Place for about 6 years now. So that would be the bulk of our practice, and we do geriatric care very well.
If the patient that you're seeing requires medication, can your people prescribe medication?
Yes, we could prescribe medication for our patients. The only prescriptions we do not prescribe are narcotic prescriptions, sure. And we recommend that into pain management, and we work with several pain management practices.
Diana, this is the first time I've heard of something like this. I mean, honestly, I can recall many times at home with our kids or even my wife or me having a problem and saying that we can't see a doctor for 2 days or a day. You call Express Housecalls. It sounds fantastic. I mean, I think it's a great service. It sounds like a great service.
Thank you. We try to do our best and really get out and help those in need. That's really how it started, and we're working very hard, the providers in the field and the office staff, to help everybody we can as fast as possible.
Jackie, give me your information again with Housecalls Express, and how do we get started?
Okay, so if you are looking to contact us, you give Housecalls Express a call at 772-781-2207, and then you could hit the new patient extension. You would speak with a staffed person in the office, and we would just need your contact information, name, address. We're going to ask you what insurance you have, and we will need the policy numbers for that insurance so we can verify your benefits. Also, an emergency contact.
Right. Review your hours that you're available and how long it takes to make an appointment.
Our office is open Monday through Friday from 8 a.m. to 5 p.m., and you can give us a call there. And it would take maybe 24 to 48 hours to put an appointment on for you once we have all the information we need to schedule the appointment.
Once you go out to the appointment and you do your treatment, but you realize that you need to admit the patient to the hospital, do you do that yourself or do you have a hospital-based doctor?
We do work with a local hospitalist group. Dr. Lahatchie has been in the area for a while, and he is at all of the Martin hospitals and St. Lucie Medical. And when we have to send out a patient to the emergency room, we contact his practice so that he can follow our patients once they're within the hospital to be sure continuation of care.
Oh, so he'll come out to the hospital too.
He is only in the hospital.
Okay. All right. And they will coordinate my care if I need more specialist or a specialist.
Right. So if you need something else, we can always send a referral to any type of specialist, whether you need cardiology, urology, dermatology, whatever you need. We work with a variety of other practices.
Okay. What would you say are the benefits of using Housecalls Express?
One of the major benefits of using Housecalls Express would be more one-on-one time. Somebody comes to you. It's convenient. You can relax in your own home while you're waiting for the provider. Maybe watch a little TV, some news, get some errands done, laundry. But then once they're there, you're all they're seeing. You are the focus. And that's got to be the most convenient part.
Fantastic. Paul?
Okay, well, you're listening to Senior Talk, brought to you by Harbor Place. Today's guest is Jackie Conkling. She's with Housecalls Express, and we'll be getting back to her right after this. And good morning once again. That's the theme song of the Senior Show, brought to you by Harbor Place. They're located right down there on Jennings Road in Port St. Lucie. This morning we have the pleasure of a guest of Housecalls Express, and she's joining us, Jackie Conkling, the marketing coordinator, along with Diane McDonough, the director of sales at Harbor Place. If you folks have a phone call for us this morning, if you have any questions, please give us a call here. Our number is 340-1590, and we'll be happy to take your call. So let us reintroduce our guest this morning, Jackie. We have Jackie Conkling and Diane McDonough. Good morning again, Diane. Let's go for the second half.
Good morning, Jackie. Welcome back. Housecalls Express. Explain to us what type of business this is.
Housecalls Express is a primary care practice that is mobile. We have providers that go out into the community and see patients in their homes or at their community, whether it be independent or assisted living.
Fantastic. And Housecalls Express is able to provide what services?
We see our patients and provide primary care services, that being regular checkups, refilling prescriptions, making referrals for specialists. We also provide ongoing care for homebound patients. Homebound doesn't necessarily have to mean bedbound. There could be a taxing reason why leaving the house has become difficult, whether you need assistance, a walker, a wheelchair, or have a certain diagnoses like Parkinson's or Alzheimer's, where getting out of the home has proven to be a little bit more difficult. We provide the majority of services available at a doctor's office. We bring the office to you is kind of our slogan, in your comfort of your own home. We can arrange for in-home x-rays, ultrasounds, EKGs, and lab work. We work with outside providers or third-party providers, in the community that have mobile practices as well. A lot of people don't seem to realize how much mobile is available these days with the growing number of seniors. Um, Times are changing and kind of going back to what used to be. But we do work with a mobile lab company, mobile x-ray and imaging company. So those things can come right to you and help facilitate some of the needs that you may have. And also, a lot of pharmacies these days are delivering, and we do work with local pharmacies that deliver your medications to you. So there's a lot of tools out there, and it's just getting the knowledge and being able to use them. We can also work with home health companies that are in our community for extra skilled nursing and needs, and added home therapy. And we also can arrange for our providers to complete needed forms if you are moving into an assisted living facility and you need an 1823 form done. Our providers could do that for you at your home. We also do skilled nursing forms, which are the 3008 that you would need once you are moved into a skilled nursing facility. We can provide employee physicals and PPD testing, immunization shots such as the flu, and our office is open Monday through Friday from 8 a.m. to 5 p.m. And you can contact a staff member at 772-781-2207, extension 7 is my phone number.
Fantastic. Well, let's talk about some of the benefits. And what I want to speak about the benefits is that I know when I go see a doctor, it seems like their time is very limited. And I forget to tell him everything I need to. And I'm like, oh, no, I should have said this. If I didn't have enough time, I know he was in a rush. So tell me about your services.
So our providers generally spend about 30 minutes at each regular follow-up appointment. So they're there with you in your home, and it's one-on-one. And you're going to see that there's more of a presence with them, an ability to open up and share with them. It's more personable. We've often had some of our patients let us know that they feel like the provider's actually listening and perhaps not as distracted because they're sitting right there with them. And they feel safer to share with them maybe some more embarrassing things that might be going on. And it's okay that we need to know those things.
Well, plus they're in their own home.
And you're in your own home,
so
which
it makes you feel a lot more comfortable.
Yes,
That
absolutely.
kind of a messaged experience for sure. Yeah.
Absolutely, and it's generally a more easygoing appointment in your own setting, if you will, versus waiting in a waiting room, perhaps, and taking hours out of your day, whereas we just come right to you.
And I think it's gives the provider more information too. I know that I go visit folks that are interested in coming to our assisted living or independent living. And when I can go into their home, I can actually see their current situation. I can see their challenges. I can feel it. It's just not a quick conversation. Let me give you a prescription, or let's take it a little bit further with another appointment. It's really getting to know them. And I think that's the same thing with your providers as they go in.
Absolutely. They can assess a situation or see a need just by taking a look around. Perhaps fall risk is a really big problem in our senior community. I know a lot of people are talking about that, maybe pointing out that maybe that rug in your dining room is not the best idea, because tripping over it may seem simple, but it's that one trip that might send you to the ER. So maybe when they're there, they can point that out, and hopefully you can say, you're right, maybe that rug needs to go, or something else, or other different calls they can make while they're in the home with you, assessing such situations as they arise.
And I would think allowing them in your home, there is that trust factor more so.
Right.
I think they'll be more willing to trust you. and to listen. And like you said, remove that rug when the daughter told you the other day and you said, no way, I love that rug. But now they're really going to trust you and because you've been in their home and you're really assessing it.
Yes, and it's not to, upset anybody, but it's only for your help, for your health, and to help you and to make sure that you're staying healthy and making better choices so that you can keep going, because we don't want you, in this case, for this example, to have that fall, because that's what everybody seems to be most scared of. We talk to a lot of patients about it. So falling is a big one. Maybe watching them with their walker or their power wheel device in the home, and you can see the challenges of those corners, those hallways, getting in the restroom, and seeing those type of things can arise. And then that way we could see what else could you benefit from? Is there something else we could order, or some other durable medical equipment that would help a patient more?
Would you help with physical therapy and occupational as well, or?
Our practice does not provide that. However, we are able to order such therapies with local home health agencies.
Oh, fantastic. I know that there are folks out there, especially the adult child, that they don't know what direction to take. So they could call you and discuss those directions. And if there's something you can't provide, you can also give them the right direction. I think that's what I do in my job. I can't always help everyone, but I think in our profession we should try to assist them in the right direction.
Absolutely. We try to, one of my jobs being marketing coordinator is going out into the community and collecting as much information that I can. And there's so many tools out there. And whenever we have a patient or a family member call us, we might have the answer for something. And so it's always a good resource to give us a call and let, we're looking for this, or does this exist, or I need help in this area. And we might be able to provide somebody or another company that can help you. There is a lot out there that's not always attainable.
I'm thinking as she's talking that, years ago when I was growing up, my mother would call the doctor, he'd come to the house. And that happens so often when we were growing up, that the medical people actually came to see you. And of course, as time went along, it became a bit more difficult, and then now you had to go visit them. The question I have for you, do you provide any kind of emergency service? In other words, if I got a problem, I should call an ambulance and not you, right?
Absolutely. We're not an emergency service. We are a mobile primary care practice, and we could see you for some urgent reasons or acute issues. However, if you are having an emergency situation, you need to stop and call 911 first. They will be the first people to help you.
Fantastic. Tell me about your physician assistants, the staff that you have.
Our whole team is comprised of physician assistants and nurse practitioners, and that is our mobile staff providers that go out into the community. We have 3 on staff right now. Donna Benya, who is the physician assistant, and she serves a lot of the local assisted and independent living communities, and she's been with us for about 6 years. We also have Brittany Wellhan Irwin, who's a nurse practitioner who's been with our practice for about 4 years, and she services Martin and St. Lucie counties, seeing homebound patients in their residential homes and at some assisted living facilities. And then we have Heather Garrison. She's our newest member, and she has been a nurse practitioner, and she services Vero to the Palm Beaches. Oh. And then our medical director, who is in contact with all of our providers, is Dr. John Gozar. He is an ER doctor. He's been with Martin and Jupiter Medical.
Yeah, fantastic. With those physicians, you must have some success stories.
We do. We have, people call us all the time and let us know how great it is to use our practice and how we've helped their loved one in a time of need. I know that a lady, Lauren, that we service in Port St. Lucie, who is a patient of Brittany's. Wrote us a beautiful quote, which we put in the Eye Care magazine. And she said, "It's beyond wonderful having my physician service take care of me at home. Brittany spends time with me and she talks to me as a person, not a patient. She knows me, she listens to me, and she hears me out. The office staff is also caring and always wants to help in any way they can." Lauren has been one of our patients for about 2 years, and in those 2 years, she's been homebound and hasn't been able to leave her house due to her certain diagnosis.
Okay. And I think you had another one as well. And
We do have a lady at a local assisted living facility in Jensen Beach who sees Donna Benya. She's been a patient with us, I believe, for about 3 years. And Mary said that Donna is very professional and she takes very good care of me. I don't need to get dressed up or go anywhere and wait. Even my labs are done here at the facility. Donna is always smiling, kind, friendly, and makes it very easy to talk to her about my medical issues. And she is just a great lady, and we love speaking to her in the office.
oh, great. And once again, tell us the benefits of using.
The benefits of using Housecalls Express, most importantly, is us coming out to your house, seeing you on a regular basis, coming into making it more comfortable, more accessible, being able to use us as a tool to facilitate a lot of your needs, maybe a little bit faster than waiting to get into another office, and just overall, generally helping people who just can't get out anymore.
I know we spoke about in the first half hour. Please tell us, if I were to call you, what were the steps that we need to do?
So if you were to call us, you would call 772-781-2207, and you would speak to a staff member. We would need your name, date of birth, the address we would be seeing you at, any special instructions for that address. Also, we are going to need your insurance information, primary and secondary if you have, with the policy numbers. We like to verify the benefits of your insurance before we schedule an appointment. That way we could tell you ahead of time. Also would need any emergency contact information for someone, or any power of attorney information if you have one.
Folks, you're listening to Senior Talk, brought to you each Monday morning about this time by Harbor Place, a location down in Port St. Lucie. They're a senior living community. Our guest today is Jackie Conkling. She's a marketing coordinator with Household Express, and she's the guest today of Diane McDonough, who's the director of sales. And if you have any if you'd like have any questions about Household Express, or have any questions you want to bring to this party, you can give us a call here, 340-1590. That's 340-1590.
I do know that Danya Benya, one of your physician assistants, does come out to Harbor Place to see our residents, both in assisted and in independent living. And it's, I'm going to say majority of the time, it is the adult child, the family member requesting this, like you had said earlier. And for reasons why they can't meet them at the doctor's office, they need a voice to call them back and let them know what's happening. They just don't feel that it'll be safe, even if we did the transportation to the doctor's office. So there's so many benefits Donna brings to our community, and I can see how that happens when you're in your own individual home. So I only hear good things about her. She provides services in-house, or she refers out as well. She comes and talks to us as a staff. She talks to the family members one-on-one, and she explains the situation to the residents, and she gives us a lot of advice as well.
Yes, thank you. Donna is a gem. She's been going to Harbor Place for quite some time, and like you said, sees independent and assisted living residents. She always makes time for that that extra step and to speak with patients' family members to explain. Often it's a challenge for family and the patient, and they're going through something. And we try to bridge the gap for our patients so that the family feels included and to help them with their loved one. And like you said, even though some facilities do provide transportation, having somebody be able to come out and see them at home, often is helpful, because sometimes the transportation is there for you, but maybe it could be a little unsafe if they have unsteady gait or something going on and you don't want to disrupt that. Or maybe a challenge that leaving the property for the day might aggravate a certain other situation. So it's generally nice to see them at their apartment in their community.
Jackie, if I am a caller or a patient calling in your service, and your representative comes to my house and makes a diagnosis, let's say, does my doctor then hear about this? In other words, how does my doctor know that I've had service? Maybe was given some prescriptions. I mean, how does my doctor end up knowing this, or do I have to tell him?
If you're not using us primarily and you're only using Housecalls Express as needed and you have a primary care, often we try to facilitate that by sending our visit note to that practice.
Okay.
So they're aware that you had a visit with us. That way that provider or that primary care office is aware of what happened when we saw you, what your vitals were, what we recommended, what we prescribed, and they have those detailed notes. That way, if there was any conflict, they could get back to us. One of the things our providers really likes to do is get medical records before we go too deep into prescribing different things. We want to make sure that whatever you've been doing, we want to continue care the correct way.
How do you get those records?
Once you have a visit, we do consent forms, and a part of those consent forms is a medical release of medical records. And we submit those to possibly your primary care that you're using, your previous, and medical hospital records. So we could see what's been going on with a patient and having a history, so we are aware of the situation. But if you are with a primary currently, we would send over our visit note, which is detailed with the visit and all of the things spoken about.
If a person had a situation where you felt that he or she should be hospitalized immediately, then do you contact their doctor? In other words, a person calls you, they're very sick, and you think they should go to the hospital. How does that step work?
One of the things our staff is trained to do is recognizing certain symptoms over the phone. If they're describing a situation and I know that putting them on our schedule is going to be too far out, we automatically say you need to hang up and call 911. If I don't think that they can call 911 and I know who they are and where they live, I will call 911 for them. Because we don't want any delay there. We don't want to have any type of situation where we didn't help you. We're not an emergency service. We can only handle so much. But if you're starting to feel like a stroke-like symptom, heart attack come on, any type of dizziness, you need to call your local 911 and go to the hospital just to be safe. It's better to be safe than sorry.
And if you could, just review the payments again. I know that's a concern for everyone.
Sure. We are in network with Medicare. So once you've met your Medicare deductible, which for 2017 is $183, Medicare will pay 80% of our visits. That leaves 20% left over. If you have a supplemental insurance, it may take that 20% and pay for it. Some supplemental insurances also pay the Medicare deductible and the 20%. If you do not have a supplement, the 20% is your responsibility to pay, and that could equal out in dollars anywhere between $25 and $45.
That sounds reasonable.
It's pretty reasonable, and that's why one of the steps in getting your information when you first sign up, if you will, or give us, the call, is we try to get all of your benefits with your insurance and let you know ahead of time what to expect. And then how to pay. We send statements out monthly to our patients, and they could write a check or they can call in with a credit card. We take Visa, Master, Discover, American Express. Some of our patients even wait until they have their next visit and give the provider cash so they can actually pick up a payment that way or pick up the check at the house if they wanted to.
Fantastic. If you can give us your contact information again, that'd be great.
Sure. Housecalls Express is phone number 772-781-2207. We are located in Stuart, Florida. You can call us. You can look us up on the website at www.housecallsexpress.com.
Great. And once again, your hours that you're
we
available?
are open Monday through Friday, 8 to 5 p.m. And we always have an after-hours staff member and provider on for urgent calls.
You did a great job today. I really appreciate you being on our show, Jackie.
Thank you for having me.
Yes, I'm thinking about signing up or calling you when I need the service because I am so busy with my own schedule.
Excellent.
But I also want to let you know that if you ever wanted to come and visit Harbor Place at Port St. Lucie or even meet Danya Benya, come out to Harbor Place. The number is 337-4330. It'd be my pleasure to give you a tour. We are located in Port St. Lucie at 3700 Southeast Jennings Road. We do have a seminar that's coming up, and it looks like it's on February the 15th, Managing High Blood Pressure and High Cholesterol. It is at 2 p.m. on February 15th. Please come if you want to do something fun with us. We have open house bingo, and that's February 20th at 2 p.m. Paul, thank you. It's been a great show.
It's been an excellent show. We certainly appreciate Jackie coming in this morning. Senior Talk is brought to you every Monday morning at 10 o'clock. I should say, 10 o'clock, that's right. And Diane's always here. Sometimes we'll do it from, her location down there in Port St. Lucie.
Yeah, that's coming up soon.
That's right, and perhaps next week. We'll be looking forward to that. And right now, today, we're looking at a patchy fog situation. I think we're pretty well done with that now. We had a lot of fog this morning out there for all you Super Bowl watchers from last night. We were all up pretty late.
Yeah, I feel a little foggy myself this morning.
Yeah, we got this morning at about 4 o'clock to get here this morning, so I'll be rushing home and perhaps laying down for a while. Anyway, our weather today is going to be, we're going to have nice sunny skies today, a high of about 76, a perfect day today. It was a great weekend as well. And tonight, partly cloudy with a low of around 61 degrees, east winds 5 to 10 miles an hour. You're listening to WPSL. We're located in Port St. Lucie. We're here every morning. Mr. G and I come on at 6 o'clock, and Cliff comes in around 8-ish or so. He gets ready for his Swap Talk show, which is always a lot of fun. And sometimes you can even see it on YouTube. You go to YouTube and put in WPSL TV. This show, as a matter of fact, will be on there probably in a couple of days. Is that right, Cliff?
About by tonight, 6 o'clock.
Okay, by tonight, 6 o'clock. There it is, folks. Listen, we had a great time this morning. Thanks for coming in, Diane. And we'll be talking to you all tomorrow morning. We'll see you then. WPSL, Port St. Lucie.